Good morning, everyone. It is December 10th. We're here for our daily media briefing, or 3 times a week media briefing. Before we get to the stats, I want to just make one kind of announcement. We've had a lot of people asking us what they can do to help, and I'm not talking about the gifts and so forth that have been so generous to us. It's this feeling of helplessness that they can't help beyond washing their hands, masking, and physical distancing. Well, we have an opportunity for you. Jeff's going to pull up a slide where we have a link to our careers page. We have positions across the hospital, and where this is really, if you really want to find a way to help and have wonderful benefits and a nice job, we have opportunities that are both clinical and support areas, and some of our support areas are getting pulled in to screening and other observer roles. So there's a real need. So if you want to help your family and help us, one great way is to go to our website. And if you get lost, here's a direct link that's on the screen, but just go to the Bryan Health website, and up in that right-hand corner where you say search site, type in careers, or actually you can see careers, there's a link right below there. It'll take you to all of our various opportunities. Again, opportunities across the house, and it is one way to really help us all get through this pandemic together. So, hey, it's out there if it's will be relevant to you, and it certainly be helpful to us. Today we have Katie Packard back by popular demand. She's going to answer some common questions that are surfacing regarding the vaccine. So after the daily stats, we'll bring Katie up and get right to it. There was one advanced question that she will cover in her remarks. We have 493 patients in here at midnight, so hovering at about the same level. Not much to report on testing results. We have 129 pending results. That's consistent, which kind of equates to what happened at the drive-thru yesterday. As far as the number of COVID positive patients in the hospital, continuing a slight downward trend, which is such a relief momentarily if that's the case, but a relief nonetheless. We hope it sticks. We have 75 patients that are COVID positive. 45 of them are now from Lancaster County and 30 outside, so we have seen that kind of tilt a little bit. There's another 17 patients that are no longer infectious but still in the hospital, so a total of 92 patients receiving COVID-19 related care. We do have an additional 12 patients in here that are pending their results, so those are typically the ones that come in between our midnight report numbers and receiving their test result. Of those additional 12, only 3 of them are from outside of Lancaster County and 9 are Lancaster County residents. In total, we have 15 patients still on ventilators. 20 of these patients are in the ICU, 20 are in progressive care units, and 41, let me back that up. 20 in the ICU, 20 in progressive care, 52 in general care. That's the breakdown. Without further delay, I'm going to bring up Katie Packard to answer some common questions that are surfacing related to the vaccine.
So in the second part of the COVID-19 vaccine press briefing, we will address some of the vaccine frequently asked questions so that individuals that are offered the vaccine can make an informed decision. Some important facts, which can also be found on the CDC website, are as follows. The Pfizer and the Moderna vaccines are mRNA vaccines. mRNA stands for messenger ribonucleic acid and can best be described as instructions for how to make a protein or just a piece of a protein. These vaccines work by providing our cells instructions for how to make the harmless spike protein that is also found on the surface of the COVID-19 virus. Special cells in our body's immune system called B cells and T cells will be formed in response to this harmless protein. These cells recognize that the protein should not be there, the same as they would recognize the spike protein on the actual virus. They build an immune defense, and they will remember how to fight the virus if infected in the future. One advantage of this technology is that the vaccine is manufactured in a cell-free environment. For example, you may have heard that other vaccines, like the influenza vaccine, are sometimes manufactured in a cellular environment, like they're grown in eggs. This is not true for mRNA vaccines. It is cell-free, and it allows manufacturers to rapidly produce larger quantities of the vaccine, which is what we need right now. Another advantage of mRNA vaccines is that in the event that the spike protein were to mutate over time, or if the virus were to develop some sort of resistance, manufacturers could adjust the mRNA sequence in the vaccine to match the new spike protein so that they could rapidly deploy booster immunizations if that's needed. Receiving an mRNA vaccine will not alter our DNA. mRNA is not able to alter or modify a person's genetic makeup or the DNA. The mRNA from a COVID vaccine never enters the nucleus of the cell, and that is where our DNA is kept. This means that the mRNA does not affect or interact with DNA in any way. Instead, COVID-19 vaccines use mRNA and they work with our body's natural defense mechanisms to safely develop immunity to the disease. The unused mRNA is rapidly degraded. COVID-19 vaccines cannot give us COVID-19. None of the COVID-19 vaccines currently in the development in the United States use live virus. And without live virus, infection cannot occur. These vaccines are incapable of infecting an individual with COVID-19. They may cause side effects such as fever and fatigue. These symptoms are normal, and they are a sign that the body is starting to build an immunity to the virus. It typically takes a few weeks for the body to build immunity after vaccination. This means that it is possible that a person could be infected with COVID-19 just before or just after they receive the vaccination, and they could still get sick. This is just because the vaccine has not had enough time to provide protection yet. COVID-19 vaccines will not cause us to test positive on COVID-19 viral tests. Viral tests detect virus, and the vaccine does not contain virus. However, it is possible that a vaccine recipient would test positive on an antibody test. Antibody tests whether or not an individual has been exposed to the virus. COVID-19 mRNA vaccines are being rigorously tested and evaluated for safety by the FDA. No steps were skipped in the development of these vaccines. Phase 1, 2, and 3 trials were conducted for both of the vaccine candidates. In fact, both Moderna and Pfizer have made their clinical protocols, which are usually proprietary information, they've made them available online for the public domain. Researchers had access to the full COVID-19 genetic code early in January 2020. And mRNA technology has been studied for decades in other viruses, such as influenza. Therefore, pharmaceutical companies were able to start developing mRNA vaccines early in the course of this pandemic. There were also unprecedented new relationships forged between our government, academia, and the industry, such as the Moderna NIH vaccine and the AstraZeneca Oxford vaccine. These collaborations further expedited vaccine development. Finally, it is very important to remember that the information about COVID-19 vaccines is rapidly evolving. As we receive more information, especially as it relates to plans to vaccinate patients and the general public, we will continue to update you. All vaccine trials exclude patients with a history of severe allergic reaction to vaccines. The Pfizer data, which was made public domain on Tuesday morning, their VRBAC report, which the FDA is reviewing today, indicated that nobody in the trial experienced immediate severe allergic reactions. The 2 individuals in the United Kingdom had a known history of severe allergic reactions to vaccines, and they had their EpiPens with them. I have not been notified of any expected delays or further research. What we will be looking for is the FDA recommendations on how to screen and exclude potential recipients that have a history of severe allergies and how broad these exclusions will be. If the EUA is granted today, we may see those recommendations today, or we may see them later on Sunday after the ACIP committee, which is the Advisory Committee on Immunizations, after they meet. We do have this on our radar, and we will apply those recommendations as we begin to vaccinate our highest risk staff and physicians. Thank you.